A new report from the Iowa Maternal Mortality Review Committee includes an eye-opening finding. 95% of pregnancy-related deaths in the state were preventable. This is from 2019 to 2021. And KCRG TV9's Emily Schrod breaks down that data.
The 2019 to 21 maternal deaths report had 19 out of 20 that were preventable, right? Talk to me a little bit about that.
One of the roles of the committee is to review all deaths that occurred to anybody who was pregnant or had been pregnant within the past year, regardless of what the outcome of that pregnancy was. So that it could include somebody, for example, who had a miscarriage or an ectopic pregnancy and then died within a year of that event. And then we're looking to understand what portion of those deaths that occurred were actually related to the pregnancy, meaning that essentially we could answer the question, would this person have died if they had not been pregnant? And if the answer to that question is no, then we would say that's a pregnancy-related death, versus if we feel like they likely still would have died even if they hadn't been pregnant, then that death is not considered pregnancy-related. So the 20 cases that the report really focuses on are the 20 cases where we do believe that the person died related to pregnancy. And as you noted, 95% of them, or 19 out of the 20, we felt that there was at least some chance of preventing that death. I think that that statistic feels really staggering to people, as it should. And it is in line with what we see nationally, that around 90% of pregnancy-related deaths are thought to have been at least possibly preventable. What I think that just the stat doesn't tell you right away, though, is what does that mean when we say a death is preventable? So it's really more of a scale. And so it doesn't mean that we think all of the deaths were absolutely easily preventable. But what it means is that when we think about all the contextual factors that include, maybe even care or situations that the person was in before they became pregnant, if we think that there's a reasonable chance that something being different in our healthcare system, in the care that the patient received, in our social support systems, or even in our communities were different, in something that's reasonable, that we think that there's at least some chance that the person might have lived, then that would be considered a preventable death.
Where do we go from here? How do we prevent things like this from happening in the future so that other reports are, not as many deaths?
The point of the report is that there are some areas where we can make changes. And so the report has recommendations grouped for 4 different kind of stakeholder groups or audiences. The first 2 groups are healthcare groups, so targeting obstetrical providers and staff such as nurses and anesthesia providers who work on obstetrical units, to take a look at the quality of the care that they're providing, making sure that their facility standards are up to date and that they're following them. The second group of recommendations are targeted at the facilities. They're very similar to the ones for the providers, but really recognizing that individual practitioners are practicing within a system. And so we need to make sure that our systems, our healthcare systems, have up-to-date policies, staff education, protocols, simulations, so that everybody's prepared to manage a pregnancy emergency in a good way.
Now.